So I will be here for a few minutes and then I'll move over to the presentation. Again, welcome to everyone on behalf of the Alzheimer Association of Trinidad and Tobago and Alzheimer's Disease International. This is the fourth ADI Non-Latin Caribbean conference, and we're very pleased to be here and that we have a whole day today to run our Alzheimer University training program, which has the purpose to help you to make your association stronger. And also we want to look at how we can work together as a region and make sure that we get Alzheimer's and dementia on our government's agenda, on the health policy agenda, and that we in this way can improve the lives of people with dementia and their families. I wonder, before we start with the presentations, whether it would be good if everybody introduces themselves. So most of you know each other, but just to be sure. And I can kick off. I'm Marc Wortmann from Alzheimer's Disease International. I will be in position until next Thursday, the 15th of June. And then I'll leave ADI. And my successor is already appointed and has started on the 15th of May, Paola Barbarino. She's in the London office now. But I will not disappear from the Alzheimer movement. I will continue to work as an independent consultant in the future, working from home in the Netherlands. And I'm sure that we will be in contact in the future as well, and that I can hopefully contribute to the work in your region. But before that, we are going to run this program. Can we start at the table here?
Good morning.
1, 2, 3.
Good morning. My name is Sandra Latibadir, and I'm from Jamaica, Alzheimer's Jamaica, in Jamaica.
Good morning, everyone. My name is Wendy McLean Cook. I too am from Alzheimer's Jamaica.
Good morning, everyone. I'm Shirley Duncan, Alzheimer's Jamaica, Jamaica.
Morning, I'm Zeta Tuller, Alzheimer's Jamaica.
Good morning, everyone. My name is Pamelia Brereton, and I am from Barbados.
Good morning. I am Roslyn Herbert, Barbados.
Good morning. I'm Imelda Charles, Barbados.
Hi, I'm Sir Wilbur, Barbados as well.
Blessed good morning. I'm Denise Summon-Sainz from Barbados.
Let me move over here.
Good morning, everyone. My name is Sophia Farrell Hassel, and I'm a member of St. Martin's Alzheimer's Foundation.
Good morning, all. My name is Julie K. Darrell, and I'm from the Alzheimer's Family Support Group, Bermuda.
Good morning, everyone. I'm from Alzheimer's Association, Cayman Islands. Dorothy Davis, sorry.
Good morning, everyone. I'm Joan Rollins from the Alzheimer's Association of St. Kitts and Nevis, formerly, though, of the Alzheimer's Association of Trinidad, but I'm now in the Alzheimer's St. Kitts.
Good morning. I'm Sam Rollins. I'm visiting for the first time meeting. I'm from St. Kitts. I'm a supporter of the Alzheimer's support group in St. Kitts.
Good morning. My name is Christine Lacombe. I'm from Suriname. My colleague, she's not here, but yes? Oh, okay. Just in time.
Morning, everybody. My name is Mavis Later. I'm also from Suriname.
Good morning, everyone. My name is Anne Smith. I'm Trinidad.
and welcome to Trinidad.
Good morning, everyone. I'm Edna Williams from the British Virgin Islands.
Good morning, everyone. I'm Filippo Hunt from St. Lucia.
Good morning, everyone. I'm Regina Poswar from St. Lucia.
Good morning. I am Hannah Winkler from Bonaire.
Good morning. I can say hello to you. Goedemorgen. Raymond?
Good morning. I'm Raymond Jesurum, and I'm here as one of your facilitators, together with Anastasia and with Mark. And I'm also in the Alzheimer's Foundation from St. Martin.
And last but not least, Norma, can you introduce you don't have to introduce yourself.
I'm Norma Innes, past president of the Alzheimer's Association of Trinidad and Tobago and chair of this committee for this conference.
So applause for our Norma, yeah. So what always happens with these events is that the host country is very busy with organizing the day, but I'm glad that you are here, Norma and Anne, and that you can follow the program as well. And
I'm Anastasia Psoma, and I work with ADI, and welcome you all.
And Raymond, do you know if there's any countries yet to come? Or is everybody here who's supposed to be here? Okay. At least we have a good audience to start. So, what I'm going to touch on in the first session is what is the global environment in which we can do our work. And I hope you can all see the screen here. The presentation should be in your folder as well. And we will also make all presentations available online after the conference. So don't worry if you miss a slide, they're all there and they're available. So this is called Global, Regional and National Plan Development. And what I want to look at is the World Health Organization Global Action Plan on Dementia that was adopted last Monday in Geneva by all the member states of the World Health Organization. The plan that PAHO already launched in October 2015. Then the national plans in currently 29 countries. And what are the opportunities for you? Because none of the countries in this region already has a national plan, but of course that's one of the things we're aiming for. So the World Health Organization is the international body under the United Nations that is dealing with health issues. And ADI is in official relations with them since 1996. But we haven't seen any initiatives in WHO until 2012, when a report was launched about dementia. So our topic has been a long time neglected. The focus from the World Health Organization in the 20th century was all on infectious diseases and not on chronic diseases. And it's step by step, slowly it's changing. And we have to campaign for that. So ADI has been actively campaigning in the last 10 years within the WHO to get their attention. But it's like moving an oil tanker. It goes very slowly, but now it moves in the right direction and then it's powerful. So the American region, the PAHO region, was the first region who identified dementia as an area of interest. And in the 2015 meeting in October 2015, they decided on a PAHO plan of action, a regional action plan. But this plan has not really been well implemented because there's no funding attached. And we will talk about that later, how we can make that better. The WHO also has an eye support project, but we will not talk about that now. But the Global Action Plan was approved just a week ago, and it was approved by all the 194 member states of the World Health Organization, including your governments. So there is a commitment, but it's only at a moral level, you could say. It now needs to go into action. And that's where we come in, because if we're not active as a civil society organization, then nothing is going to happen. So what we learned in ADI over the years is how to be good advocates. And you know what an advocate is someone who, it comes from the Latin, advocare, it's someone who talks on behalf of somebody else. So we are representing the families of people with dementia in our countries, and we talk on their behalf. That is what is called advocacy. But to do that well, you need to have research data, for instance, on how many people have the disease, how many new cases are there every year, what is the mortality rate, because governments want to know these things before they start planning. We found out that training on advocacy is important because nobody is born with this, nobody knows how to do it. So you have to get training in how to do it. Of course, keeping the message simple and clear is very important, and asking for realistic demands to your government, things that they can do. Then another important thing is building coalitions. We're too small as a movement to do everything on our own, so we need to find others that can help us. We need to build a network. And we have to speak with one voice and often with one face. And finally, finding champions. Well, that's a lot of information, and I will go through it one by one. So what ADI has done, thanks to our research community, we are able to provide the world with the global data about dementia. And that is done every year in the World Alzheimer Report. And the 2015 report was an important one because it has the latest data on the numbers, and that is the prevalence, so how many people at this point have dementia, the incidence, that's the number of new cases in 1 year, and the cost of the disease, the societal cost, which is the cost of hospitals, doctors, medication, nursing homes, daycare centers, but also the time that families spend to care for their loved ones, so the informal care costs. Because if they do that, they cannot work, they cannot earn an income, so there is a cost attached to it, which is often forgotten. And this report has been important because it's picked up by the policymakers everywhere. And it was done by an independent research group from King's College in London and Karolinska Institute in Sweden. And what the researchers found is that the number of people with dementia in 2015, and this is an estimation, we haven't counted everybody, but it's a good estimation, was 46.8 million. And if we don't find a cure, the number will triple by the year 2050 because of the aging population in the world. You probably know that at the age of 60, there's a small proportion of the population with dementia. It's already larger at 70, and then it's even larger at 80. And you can break these numbers down and then look at the population estimates for the future. And the expectation is that we will have many more elderly by 2050. So if the same percentage of elderly will have dementia then as now, then the number will be 131. Of course, we hope that's not going to happen. Our efforts are not to make it happen, the 131 million, because it's far too much. So if there is a cure coming somewhere, the curve may bend and get down. Or if we find better ways to promote healthy lifestyles and prevent the disease, it may bend down as well. But for the time being, this is what we know. We also know that in 2015, there were almost 10 million new cases in the world. And that's 1 in every 3 seconds. And if you compare that to other diseases, for instance, HIV/AIDS, there's 1 new case in every 12 seconds in the world. So there are 4 times more dementia cases than HIV. Every second, there are 4 babies born. So against 12 babies that are born, 1 person gets dementia in 3 seconds. That's quite a frightening number. Another frightening number is the cost of the disease. In 2015, this was calculated at $880 billion US. And it will go to the $1 trillion in 2018, next year, and $2 trillion by 2030. Now, you and I don't know how much that is. We have no idea. So we thought of looking at what else will cost $880 billion. And actually, if it was a GDP of a country, the total economic value of a country, that would be the 18th largest country in the world. It's a bit comparable with Indonesia or Turkey, the economy of those countries, the cost of dementia. If you look at the most wealthy company, Apple, that's less than 818 billion. So it's really a big number. Okay, what did we do with WHO? We launched this report in 2012, which was a collaboration between ADI and World Health Organization. That's not so usual, but because we have a large network all over the world, we know a lot of researchers and experts, we were able to bring them in to work on this report. By that time, it was a new case every 4 seconds. Now it's every 3 seconds, and that's only 5 years ago. And the report was the first call from WHO to member nations to act and to develop their own policies. But a report is only paper, and there's more need for other action. And after the G7 held a meeting, the G7 government held a meeting about dementia, the World Health Organization organized a ministerial conference in 2015. And we asked all of you, all of our members, to chase their governments, to chase their ministers of health to attend. And many of them did. 80 countries sent an official delegation to this conference, which is a huge number. There was strong commitment from the WHO leadership. The Director General, Marc Wortmann, opened the meeting and did an opening speech and also closing remarks. And she thought she was afraid about dementia herself at age 68. And she thinks it's one of the most important areas for the future. Many people from the lower and middle income countries were also speaking at this event, and there was a declaration accepted. And then we went away from this conference with the idea that this declaration should be converted into a global action plan. Now, how WHO works, it's a UN agency, which it means that it's governed by the member states. So the staff of WHO is important, but the member states take the decisions. And that's with 194. So this room would be too small to have a governing body of WHO. You need 194 countries. They use 6 languages, so they're interpreters. And the member states negotiate about the decisions. So you can imagine that this is a slow process. However, if there are some countries that take the lead and propose things, then things get moving. And in this case, it were Dominican Republic and Switzerland who proposed to the board of WHO to make a global action plan. And that was supported by many other countries. And then the staff was tasked to draft an action plan, and that was discussed in May this year and adopted. Now, what does this plan say? We compared the draft of the plan with some of our own documents to look at if the elements that we are always asking for, if they are in the plan, and they actually are. So in the recommendations that ADI made in the past of what we want to see in a global action plan, and I just stopped to say good morning to Dale Goldhawk, who came in early this morning from Canada. Good to see you, Dale.
Nice to see you as well.
Can you introduce yourself?
I guess my name is Dale Goldhawk. You've already heard that. I'm among a number of things, I'm the Vice Chair of Alzheimer's Disease International. I chair a committee at ADI that looks after communications, dealing with the media, that sort of thing. the chairman, Glenn Reese, made me the vice chair because he thought I might know something about communications. I've been in the practice of journalism for 48 years now, so I picked up a few things here and there.
Okay. And you're also the previous chair of Alzheimer's Society of Canada. And Canada has been in contact with many of the countries here in the Caribbean region. Is a bit of a mentor for some of you. And we hope that can continue. So Dale, I was just touching on the global environment and the WHO plan. So the plan that WHO made has all the important elements, and it has targets. So there are some targets to reach by the year 2025. And the experience in the international bodies like UN and WHO is if you don't have those targets, then the plans are weak. But you have to have a target to try to reach. And I will talk later about which targets there are. And we think it's a good plan. Overall, we think it's a important plan, it's a strong plan. The only disappointment is that the research area is not well developed. And that in ADI we believe that there's a need for a big increase in research investment compared to what is done in the cancer area, and otherwise we are not going to find a cure. The WHO plan has a vision and a goal. A vision is a world in which dementia is prevented and people with dementia and their carers live well and receive the care and support they need to fulfill their potential with dignity, respect, autonomy, and equality. So there's a lot of elements in this vision, and you can see that there is a kind of human rights-based approach in WHO, looking at the dignity of people, respect for people, the autonomy of people, and equality. And there's also this element of preventing dementia, but at the same time caring well for those who have it. And the goal of the plan is a public health response to dementia to improve the lives of people with dementia while decreasing the impact of dementia on them as well as on communities and countries. Interestingly, in the first draft, it only had the last half of this sentence, so it wanted to decrease the impact of dementia. And then we, among other organizations, we had a chance to comment on the plan, to make comments, to give input, and we said, you should say this more positive. You should say, really look at improving the lives of people, not only decreasing the impact. So they added that to the goal. The plan is based on 7 principles: human rights of people with dementia, empowerment and engagement of people with dementia and their carers, evidence-based practice for dementia risk reduction and care. So this is always an important issue at WHO, that the recommendations they make and the actions they make, that they are evidence-based, that there is research done, and that's not just random policy, but that there is a sound foundation. Then multi-sectoral collaboration on the public health response to dementia. So dementia is not only a health topic, it's also a social topic. It has financial impact, it has impact on housing, on transport. So there needs to be a public health response to take all of that into account. Then universal health and social care coverage for dementia, equity and appropriate attention to dementia prevention, cure and care. That's really a mouthful, and now we're going to see how they work that out in 7 areas. So the first area of the plan is dementia as a public health priority. And the main target here is that 75% of countries will have developed or updated national policies, strategies, or plans, either standalone or integrated in others, by the year 2025. That's a long sentence. And I got complaints from ADI member associations that said, we don't want this to be 75% because my government will walk away and say, okay, we can be in the 25. So we recommended to make it 100%, but they didn't do that. However, at the moment, it's only 15%, 1/5. So 29 countries have a plan. By the year 2025, it should be 150 to reach this target. So that's a big, big effort. I think we need to work on it to make it 100%, but at least close to that. And this requires actions from the member states themselves, from the WHO Secretariat and the partners, other partners. But it's really a commitment from governments to develop these plans. And we know that there are governments working on it, more governments than have plans now. But we will certainly talk later today about how you can make that work in your country, what you need to do and what you need to know to make it happen in your country. The second area is also very interesting, dementia awareness and friendliness. So to be able to get it on agendas, the WHO recognizes the importance of awareness raising. If we don't talk about dementia, if people don't know anything about it, it's very difficult to get any policies in place. And here they listen to us and they increase the number of countries that should do an awareness campaign to 100%. So all the 194 countries in the world should do an awareness campaign on dementia before the year 2025. And 50% of the countries should have a dementia-friendly initiative to foster a dementia-inclusive society. So these dementia-friendly community initiatives are popping up all over the world. And it's one of the ways to raise awareness. It's not so common yet in the Caribbean, but maybe that can change in the future. What we have said in our contribution to the discussion is that this is an area where Alzheimer associations should be included. They have the knowledge about awareness, they have the knowledge about the lack of awareness in their countries. They know the language, they know how to talk to people, how to reach people, and they can be spokespersons. So we have strongly recommended to WHO that you should be involved in these campaigns by your government. And Anastasia will later this morning show a campaign that was run in the UK by the UK government and the Alzheimer's Society UK. Area 3 of the plan is dementia risk reduction. And this says that if we do all the measures that are already agreed for the other non-communicable diseases, cancer, heart, diabetes, and lung diseases, that will help reducing the risk for dementia as well. It's a bit weak, I think, because this is something that was already agreed by WHO, and they just added as a paragraph to the dementia plan. However, the measures for diabetes risk reduction, heart disease risk reduction are all good for the brain as well. It's the things as stimulating physical activity, healthy diet, and those kind of things. Now, in the meantime, during the week that we had in Geneva, the WHO has made a next step, and they are now looking into, they created a working group to look into specific dementia risk reduction measures. And they want to do some research into that and then come up with recommendations. And one additional risk factor for dementia that is not so common for the other diseases is education. So people with low education have a higher risk to develop Alzheimer's or other dementia. People who learn more languages have a lower risk. People who are using their brains all over their lifetime have a lower risk to develop dementia, which is never a guarantee for you if you speak 3 languages that you don't get it, unfortunately. But if 100,000 people do that, then less people will have dementia than another group of 100,000 who don't do these things. So you can reduce your risk. And that's important to know. And it has a lot of other advantages as well to keep your brain active. Then the 4th area of the plan is dementia diagnosis, treatment, and care. And the target here is that at least 50% of the countries, 50% of the estimated number of people with dementia are diagnosed by 2025. Again, we should say this should be 100%, of course, but where we are now, it's far, far less than 50%. There are hardly any countries where 50% of people are diagnosed. So to make this happen, this is an area where a lot of work needs to be done. And the proposed actions are to develop a pathway of efficient, coordinated care for people with dementia, train the workforce, and shift the locus of care towards the community. So in other words, it's important that not only the specialists know about dementia, but that the primary health care system is also informed and trained. Because there are not enough geriatricians and neurologists and psychiatrists in the world to diagnose everybody. It's physically impossible. So we need the help of the family doctors and the primary health care as well. Area 5 is support for dementia carers. You all know about this because many of you are a carer yourself, and that's why you're involved in this movement. And the target here is that 75% of countries should have a support program and a training program for carers and families with dementia, families of people with dementia by 2025. Again, this is an ambitious target because not many countries do have that already. And it's also an area where our associations can jump in and offer their expertise. Then area 6 is about information systems for dementia. And the experience in WHO is if you don't count anything, if you don't have the numbers, you can never measure the impact of policies, and you don't get things done. So there's an ambitious plan. They have created what is called the Global Dementia Observatory, which is an office in Geneva that is tasked to monitor the data systematically and ask governments to provide data on dementia. This is not happening yet, so there's very little data. The ADI data are the only data that people are using because there's nothing else. And we're of course pleased with that, but we would prefer that there are better data. And this is a way that WHO could do that. And then finally, research and innovation, where the target is to double the output of dementia research by 2025. And the way that's measured is to look at the number of scientific publications on dementia. Well, as I said before, we think this is not enough. And in our statement at the World Health Assembly, Paula, our new CEO, has made clear that ADI wants at least 1% of the global costs to be invested in public funding for research, which means that governments need to spend 4 times more than they do now. And that's not easy, but we will continue to ask for it. Well, this is not so important. Then moving to the national plans. At the moment, 29 countries have a national plan. And that's quite a lot, and therefore you cannot read it. But for today, the important thing is there's no Caribbean country yet on this list. It would be great if one of you can be the first in the near future. And we will talk later today about this more specifically and zoom in how in other countries our associations have been able to make that happen. Because most of these plans have happened because people like you have campaigned for it. It's not that the governments themselves start thinking and say, hey, this is an area where we should do it. There is always a need for a chaser. And actually, in an event at the World Health Assembly in Geneva, we had the Minister of Costa Rica, who has a national plan. And he was asked, why did you do that? And he said, well, we were chased by the Alzheimer's Association. And they constantly chased us, so that's why we did it. And that was very encouraging for the people in the room. So how to get a national plan? The World Health Organization gives a framework. The 7 areas that were described here before could be a perfect template, a model for a national plan, because it has all the important elements. Your government has committed in May 2017. So now the question is how we're going to make that happen. And we need to seek allies for that. And one ally is the World Health Organization regional office and the country office. And in this region, that's the PAHO. And the PAHO has an office in every country with a few staff. And they are your partners. They can be your allies to chase your Ministry of Health. Other NGOs can also be helpful. NGOs in the aging field, in the chronic disease areas. I think that Trinidad was asking me recently, can we become a member of the NCD Alliance in Trinidad? And yes, you can, because you're in the Global Alliance, we are also a member. So that can be allies for you. We have to mobilize the public. There have been countries where the associations did write petitions to the Ministry of Health or the Prime Minister, or they collected postcards, or they asked people to, in Scotland, for instance, they gave postcards to all the members of the association. And it said, "Dear Prime Minister, we want a dementia plan." And people were asked to post them by the time of the elections. And it was very, very effective action, because they got their plan. And it was by mobilizing the public, by showing there are thousands of people affected by dementia. This is not just a few experts talking about it, it's a real societal issue. Organize events. Tonight we got the Minister of Health from Trinidad here, so an event like this is an effective way to get to a national plan. Use ADI. Sometimes we need to tell it to the minister or to the media, and that can support you as well. And by 2020, there will be a first review of the WHO plan, and then they will look at the numbers, and then they will see, oh, there's not much progress, so we need to speed up. And that's an opportunity that we can use. And then there's the human rights approach. So what we have seen recently, and it's nice that Dale is here, that Alzheimer's Society Canada has joined a number of other NGOs from the disability world, and they formed a coalition, and they asked for dementia to be included in the review of the Convention of the Rights of People with Disabilities, which is a UN treaty that many governments have signed, many countries have signed, and it's an additional way to get attention. Well, we already talked about the NCD Alliance, and that's a very effective international collaboration. And until a few years ago, it was led by 4 diseases: cancer, heart, lung, and diabetes. And we were asked to join, and at the moment it's increasingly expanding to other disease areas, other chronic disease areas. And they started to work as an informal network. So there was no formal NCD alliance until a month ago. It took a few years to create an NGO. But by working together, it was already very effective and has a strong voice internationally. What can you do and how can you use ADI for that? Our reports are available for everybody, and there is no copyright. So if you want to quote text from the report, if you want to use a slide from the report, it's all free to use. So please do that. Don't hesitate. And don't ask the office, can I do that? No, it's there for you. It's to support your work. And it always impresses people if they hear about the global numbers. And ADI has the data from every country as well. I'm not sure if we have the data from every island in the Caribbean, but probably we can make an estimate. But we're looking into ways to do research here in the region and get proper data as well. A letter to your Minister of Health or other key officials can help. It can be co-signed by ADI. We have examples in our office from those letters. So if you think it's the time now to get an appointment, to talk about a plan, or to talk about other issues, maybe you don't want a national plan first, but you have a smaller target, that can always be done. Then what I call the Taiwan approach, the Taiwan Association said we don't get heard by our government, so ADI, please can you help? Can you join us in a meeting with the Minister of Health, with the Vice President, with members of Parliament? And we did that several times in the run-up to the conference in 2013. And it helped and it worked because at the time of the conference, the government announced that they were going to make a national plan. And in the meantime, that happened. And other countries did the same, like Indonesia, Slovenia, Mexico, and Argentina. So myself and Johan has been to ministers of health with our member association to talk about dementia policies. And if there's someone from abroad, that sometimes helps to open the door, to give a little bit of leverage, make it more important. Of course, there is a limitation in resources and in time that people have. And I cannot decide for the future if Paula is able to do all those things. But it's something to think about. One of the opportunities, of course, is World Alzheimer's Month and World Alzheimer's Day. And I think you use that well in the region. And that's an opportunity to engage with policymakers, to invite people, spokespersons, and to do an ask. And then, of course, and this is all thanks to the vision of Raymond, we need to think about a joint response and a joint action from the region. Is it possible to develop an overall plan for the Caribbean that can be used instead of doing country by country? Is there any way to make that happen? But then there's need for data and for funding, and we will further talk about that today. And these are the ADI contact details. You can find us on Twitter and Facebook, and of course our website. And intranet is something to mention as well. If you go to the website address and then /intranet, you will find presentations and papers and reports that are useful for ADI members. So thanks for listening so far. You have been very quiet. It's the beginning of the day. I don't know if there are any questions or comments. Yeah.
Thank you. Mark, a couple of the things that you mentioned that ADI could assist with, the letters, the data, the documents, is this only for official members of ADI, like the countries that are officially member, or is it for all of us?
Yeah, that's a good question. In general, it's for members, but if you are in the membership development program, and you all are, if you're not a member yet, we can do it as well. And we can say this organization is just starting, and they will become a member of ADI in the future. And in the meantime, we already support you. So there's always a way, and we have native English speakers in our office who are very good in using the language in a diplomatic way to go around issues if they are there. So no worries, that's possible. Yeah.
Thank you. I just want to thank you for this very useful presentation, because we all know there's just so much work we still all have to do. And this was particularly helpful to me when talking about how to approach persons, like persons from the Ministry of Health and so on, because I find that there's still not a great awareness of how much work there is that we need to do. And you know, we invite persons to our major events from the Ministries of Health, and sometimes they don't come, you know, so it's very discouraging, but such a presentation as yours this morning just reminds us that we need to get on with it and, you know, make them uncomfortable by our pressing on. Okay.
Yeah, you know, this is the case all over the world. When I started in the Netherlands, we were starting a collaboration with two universities to work together on dementia research and awareness. And we invited the Minister of Health, and we didn't get an answer. There was no yes or no, there's no answer. So we started calling and said, okay, this event is coming. Is there anyone, can anyone respond? Because if we have a no, we have to find another person. And then we found out that there was nobody in the Department of Health, this was 2001 in the Netherlands, responsible for dementia. No section. And so we finally identified one officer who wanted to talk about it and said, you know, forget about the invitation, we find someone else. But make sure that one of the sections of the department becomes responsible for dementia, because this is an important topic and it will be increasing. And then in the WHO had the same experience, that nobody took any care of it. So that's the first thing you need. You need to have a contact. You need to have a partner in the government. And it doesn't need to be high up. If it's a director of a department, or if it's a senior person or a person with a little bit of authority, that could be enough.
Yes, thank you for the presentation. And I'm hoping that probably all the countries can have a copy of this so we can impress the powers that be in the countries about the importance of this. Now, it's a chicken and egg situation, because in the slide number 4, you mentioned number 4 about the importance of having rates so that we can speak to the powers. But the truth is, in absence of a strong research group, research potential in the countries, it's difficult to generate data on rates. Where do you think we should start here? Because one needs to be able to impress them that this is a huge problem. But for the various little countries, say St. Kitts and Nevis, how do you say 10%, 20%, when there are nobody's collecting data? And where do we start with this?
Yeah, that's true. The way to do that is to look at what is the most likely comparable country. So in this case, the data from Cuba and Dominican Republic, and of course it might differ a little bit, but it's sort of the closest countries where we have data. And then the data say that in the age band from 65 to 70, for instance, 2% has dementia. From 70 to 75, it's 4%, etc. And you can compare that with the statistics of your own population, and then you can make an estimate of what the number would be in your country. And of course, it's not exact, but it's a good guess. It's an informed guess. And we can do those calculations. So for most countries, if your country is an independent country and not a territory, which some of you are, then we have the data. And for the other ones, we can probably find it. But the ideal situation is if there's real-world evidence, if there's research done. A very, very easy rule of thumb is that 1%, if you don't know anything, 1% of the population has dementia. So roughly, if you have a very old population, then it's probably 1.5. So if you have 100,000 people in your country, you might have 1,000 people with dementia. But that's really on the back of an envelope estimate. Okay, shall we move to the next item? Thank you for the questions, and they're all very relevant. Now, we were supposed to have Dr. Cayetano here from WHO, who spoke at the conference in Barbados last year. But last minute, she had to go to another meeting, and she had to cancel, and there was no colleague available anymore to take over. But Raymond has got her slides and some WHO slides. I think he's a very good stand-in. So, Raymond, the floor is yours to present the view of PAHO.